This segment is sponsored by GBMC Healthcare.
Hey, you guys. So October is National Domestic Violence Awareness Month. On average, nearly 20 people per minute are abused in the United States. An estimated 1 in 3 women will face domestic abuse in her lifetime, and 1 in 25 men have been injured by an intimate partner. Joining us to talk about domestic violence is Laura Clary, Clinical Program Director for GBMC's SAFE program. Hey, Laura, how are you?
Hi, I'm good. Thanks for having me.
Oh, thank you for joining us. So how has your SAFE and DV program at GBMC been helping victims of domestic violence?
So one thing that's really important to us is that we know that crimes like these don't stop in the middle of a pandemic. So we wanted to make sure that our services were always available for anybody that would need us. So making sure that we maintain 24/7 coverage of forensic nurses and victim advocates to respond to the hospital at all times was incredibly important. So we always had someone ready to come in and help.
Okay, good. So have you also seen an increase in the number of victims of domestic violence during the pandemic?
So when the pandemic first started, we actually saw a decrease because people were not able to get out of the house to get somewhere safely. People were afraid to come to the hospital because of being around other sick people. So we actually saw a decrease in the beginning, which was really alarming because we knew that this wasn't stopping. It was just that people didn't have a way to get to us safely. So since things have opened back up, we have really seen a pretty big increase with our patients coming in for domestic violence and sexual violence as well.
Okay, so what makes physical abuse more of a risk during the coronavirus time?
So again, I think because people are stuck at home with their abusers, they don't have a way to safely to get out. Additionally, people are under a lot of stress right now. There's financial stress, there's childcare stress, and again, just being in that confined space of being in that house, it really increases tension, which makes it more likely for somebody to have an explosive physical abusive situation.
Okay, what signs should we be looking for also?
So basically what we look for, I think everyone immediately thinks of bruises and things like that, but domestic violence takes many different forms. So what we're looking for are these controlling behaviors. This can come in the form of emotional abuse and their partner constantly putting them down or not allowing them to, seek medical treatment if they are having some kind of a medical problem. Again, we do see physical abuse and digital abuse and just different things to look out for. If you notice that your family member is not keeping in contact with you when they used to, and they're kind of withdrawing from things that they previously enjoyed doing, that may be a time that you want to reach out and see if they're okay.
Wow, Laura, your job is so important. Thank you so much for sharing that information with us today.
Thank you.